Hi, I'm Dr. Mark Askenazi.
Hi, I'm Julie Rogers, aesthetic therapist.
And we did a talk about the way the Dermapen works, which is a microneedling device, and now I'm going to be doing a demonstration on Julie to show how it's actually done in practice. Julie's been prepped with half an hour of local anaesthetic cream, so her face is nice and numb, hopefully.
Yeah. And
going to be applying some hyaluronic serum as a lubricant, which I'm just going to put on now. There a second. I'll just put a little bit of this on. Start on a 1mm setting, like so. The length of the needles is adjustable. Just bring that out there. And on the forehead I would normally use a 1mm setting. And how's that feeling, Julie?
Absolutely fine.
Yeah.
You can slightly feel something, but it's completely fine. It's not uncomfortable.
Not too uncomfortable. And already I'm starting to see some pinpoint bleeding just for those first few sweeps across there. This incidentally is also quite an effective treatment for baldness, because it stimulates blood flow. Now, that's that area complete, so I'm just going to switch off a second. You can see the treatment's actually quite quick, particularly compared to the old-fashioned derma roller. I think that was a lot less comfortable, wasn't it, Julie?
I gave up using the derma roller quite a while ago, purely for the fact it was just too uncomfortable.
Yeah.
I find with the Dermapen, the procedure's fine, and you're seeing the results as well. The results being a lot better than the derma roller as well.
Yeah. I'm going to keep it on a 1mm setting just for the time being, because I'm going to go in this delicate area just under the eyebrow. And you can see, because of the width of the sterile disposable needle holder on the Dermapen is quite narrow, you can get in there and rejuvenate that area. And then around the side of the eyes, just using a circular motion. I'm just doing it till I can see some nice pinpoint bleeding. It doesn't have to be too drastic. And if you could just look up for me, please, Julie. I'm just going to go right under the eye. And what's that like at the moment?
Can't feel anything. Fine, absolutely.
Just a slight vibration, maybe.
Yeah, that's about it.
Over the nose. It's a slightly more sensitive area around the nose. So switch off a second. A little bit more lubrication in there. This lubrication is a hyaluronic acid serum, so the skin, because of the microneedling, is able to absorb that very well, and it plumps out the skin very nicely, and as well as hydrating it. Now I'm going to switch over to a slightly longer needle length for the lower part of the face, 1.5. the skin here can tolerate the 1.5 needle length much more easily than the very delicate skin around the eyes and on the forehead. And so with a 1.5 you get slightly deeper penetration with the needle, and so a slightly more profound rejuvenation. And what's that like across the upper lip?
Fine.
It's okay. Really sensitive area here, and this is great for helping to soften very fine lines on the upper lip. This is a very complete facial treatment, and as well as the face you can use the Dermapen on the neck. A little bit of lubrication there. Is that okay on your neck, Julie?
It's absolutely fine. All you can feel is the slight vibration of the pen.
Come on the other side now. And the other side there. You can see it just makes the skin slightly red. And that will settle down usually within a day or so. And you start to see the rejuvenation effects usually after a week or two. And that reaches its peak at about 6 weeks. So at around about 6 weeks you can have another treatment to give that a boost. And most of my clients who come to see me will have a course of 3. If you have acne scarring, this is an excellent choice. And I've seen some really nice, quite dramatic improvements in acne scars. And normally those will take between 3 and 5 treatments. Because of the new collagen and new elastic fibers that develop as a result of this treatment, you also see a little bit of tightening in the facial features and improvement in volume. Just going to drop back down to a 1mm again. You okay there, Julie?
Yeah. It's so much more manageable, like you see across the top lip. The dermal one really was not pleasant at all. I find that you just don't feel it with that, apart from the slight vibration of the pen.
Yeah. It looks pretty dramatic, but that will settle down quite quickly.